Who qualifies for targeted therapy in pancreatic cancer? Imagine a treatment that targets cancer at its very core, but only if your tumor has specific features. That's what targeted therapy aims to do in pancreatic cancer. Not everyone with pancreatic cancer will qualify, but many can benefit if their tumor has certain genetic or molecular traits. The key is detailed genetic testing. Doctors perform comprehensive genetic sequencing of the tumor tissue, called somatic testing, and sometimes germline testing, which looks at inherited mutations. These tests can reveal mutations like BRCA1 or BRCA2, which are linked to DNA repair or other alterations such as RET fusions, KRAS mutations, or BRAF changes. Up to a quarter of advanced pancreatic cancer patients may have mutations that make them eligible for targeted treatments or clinical trials. Most targeted therapies are considered for patients with advanced or metastatic pancreatic ductal adenocarcinoma, the most common type of pancreatic cancer. They are usually not used for neuroendocrine tumors, which are a different kind of pancreatic tumor, although some drugs are approved for those. Patients whose cancer has spread or who have not responded to standard treatments might be candidates for targeted options, especially if genetic testing shows actionable mutations. In many cases, a molecular tumor board reviews the genetic profile of the tumor. This team of specialists evaluates the data and recommends targeted therapies suited to the tumor's specific mutations. Patients must be willing to undergo these personalized treatments, which are often part of clinical trials. Clinical trials have their own criteria, including age, overall health, performance status, and absence of uncontrolled infections or other serious health issues. Patients need to give informed consent and meet the specific requirements of each trial. Certain genetic mutations open the door to specific targeted therapies. For example, patients with germline BRCA mutations may benefit from PARP inhibitors, which interfere with DNA repair in cancer cells. Those with RET fusions, although rare, might be eligible for drugs like selpercatinib, which has FDA accelerated approval for tumors with RET fusions. Other mutations, such as alterations in genes like CDKN2A, BRAF, or ERB2, might also guide targeted treatment choices, often within clinical trial settings. It's important to remember that a patient's overall health matters. They need to be able to tolerate oral medications, have no uncontrolled infections, and not be pregnant or breastfeeding. Understanding the treatment process and providing informed consent are essential steps. In summary, qualifying for targeted therapy in pancreatic cancer depends heavily on the tumor's genetic makeup. Genetic testing and counseling are crucial to identify actionable mutations. The decision to pursue targeted therapy involves collaboration with oncologists and molecular tumor boards, considering the patient's health status and the availability of approved drugs or clinical trials. Every patient is unique, and personalized treatment plans aim to give the best possible outcome based on individual tumor biology. Always consult healthcare professionals for tailored advice and treatment options.